Okay, so this is our presentation on the adrenal cortex by Myra, Giovanni, and Dina. We're going to have four main parts going over the adrenal cortex, Cushing syndrome, adrenal insufficiency, also known as Addison syndrome, and a short case study afterwards. So the adrenal cortex is part of the adrenal gland that sits on top of the kidneys. It's responsible for producing a variety of hormones that play an important part in regulating the body's metabolism, immune system, blood pressure, and more. These hormones that are produced are classified into three main groups: mineralocorticoids, glucocorticoids, and androgens. Glucocorticoids, such as cortisol, are involved in the regulation of the body's metabolism. They help to break down proteins and release energy, and they can also increase blood sugar level to provide the body with a quick source of energy. Mineralocorticoids, such as aldosterone, are involved in the regulation of electrolyte balance and blood pressure. They act on the kidneys to increase absorption of sodium and water. The adrenal cortex also produces small amounts of androgens. The most important androgen produced in the adrenal cortex is DHEA, which is converted into testosterone, and estrogen, which plays a role in the development of secondary sex characteristics such as axillary and pubic hair, and for the maintenance of bone density. And this is where we hand it off to Dina for Cushing syndrome.
Thank you, Gio. So Cushing syndrome is a rare disorder that occurs when the body is exposed to high levels of cortisol for an extended period of time. Now we'll dive into what cortisol is, how it affects our bodies, the function, along with risk factors, signs and symptoms, and labs and diagnosis. So cortisol is a hormone that is produced by the adrenal glands. It's released into the bloodstream in response to stress, and it's responsible for a number of bodily functions, such as regulating blood sugar levels, blood pressure, and the immune system. And there are several causes of Cushing syndrome, but the most common is the overproduction of cortisol due to excessive stimulation of the adrenal cortex by ACTH or adrenal tumors. And about 85% of Cushing syndrome cases are caused by ACTH secreting pituitary adenemas. And these tumors cause the pituitary gland to produce excess ACTH. And in turn, that stimulates the adrenal glands to produce excess cortisol. Also, another common cause of Cushing syndrome is the use of exogenous glucocorticoids such as prednisone or dexamethasone for long periods of time. And these medications can suppress the normal function of the adrenal glands. So the first risk factor for Cushing syndrome is prolonged exposure to high levels of cortisol. And this can occur due to several factors such as adrenal tumors that produce excess cortisol, or corticosteroid medications that are used to treat conditions like asthma, rheumatoid arthritis, and lupus. Also, pituitary tumors that produce excess ACTH. And this is a hormone that stimulates the adrenal glands to produce cortisol. And when the pituitary gland produces too much ACTH, it can lead to excess cortisol production and the development of this syndrome. Also, adrenal gland tumors that produce excess cortisol can also be a risk factor, and these tumors are usually benign and causes excess cortisol production. But in some cases, there are familial predispositions or genetic mutations such as that can cause cortisol overproduction. Also obesity and insulin resistance, along with chronic stress or depression. So Cushing syndrome is characterized by a range of signs and symptoms, including weight gain, moon phase, facial plethora, back hump, muscle weakness, but the most common symptom is weight gain. And in addition to these visible changes, the patients may also experience muscle weakness, have glucose intolerance, which can lead to hyperglycemia and hypertension. And this increases the risk of heart disease and stroke. Other symptoms include excessive hair growth, that's usually in women, and easy bruising. Men may also experience testicular atrophy and breast development known as gynecomastia. And lastly, the syndrome can lead to osteoporosis, which can increase the risk of fractures. And this slide just has a couple more pictures if you want to pause and look at it. So we'll go to the next slide. So patients with Cushing syndrome may experience activity intolerance, fatigue, weakness, disturbed body image due to changes in body shape, excess fluid volume caused by failure of regulatory mechanisms, sexual dysfunction related to loss of libido, impaired skin integrity due to thin, vulnerable skin from the effects of increased cortisol, and is at risk for infection due to the suppression of the immune system. And lastly, the patient is at risk for injury due to decreased muscle strength and brittle bones. So here are some important nursing concepts and interventions related to the syndrome. So we have to ensure proper fluid and electrolyte balance, monitor for hypernatremia, hypokalemia, hypervolemia, and check the patient's daily weight and vital signs. For glucose regulation, it's important to monitor blood glucose levels, while for metabolism, monitor the daily weight. The patient should be educated on proper diet and exercise. To maintain skin integrity, the skin should be assessed for signs of thinning or bruising, as well as delayed wound healing. Also, infections should be monitored for signs and symptoms. The patient should be advised to report any occurrences. And when dealing with sexuality, it's important to assess for amenorrhea and to educate patients on the effects of medications and the return of normal hormone levels. Lastly, depression should be monitored for as far as hormonal regulation. So one of the key lab tests used to diagnose Cushing syndrome is the measurement of free cortisol levels. And this can be done through a 24-hour urine sample, a midnight or late night salivary cortisol test, or a low-dose dexamethasone suppression test. And these tests help to determine whether cortisol levels are abnormally high, which can indicate the presence of this syndrome. Also, a complete blood count, CBC, or white blood cell count may be done to evaluate for potential infection or inflammation. Other diagnostics such as CT scans and MRIs are used to diagnose since they help identify the presence of pituitary adenemas or other abnormalities that may be causing excessive cortisol production. And one of the most common complications is obesity, which can contribute to other health problems such as hypertension and diabetes. The patients are also at increased risk for developing osteoporosis due to the effects of cortisol on bone density. And now I'm going to hand it off to Myra.
Okay. I'm going to be talking about adrenal insufficiency. Okay. This condition can occur when the adrenal glands do not produce enough of certain hormones. The adrenal glands are small organs located above the kidney that play a crucial role in the body's stress response, as well as the regulation of blood pressure, blood sugar, and salt and water balance. Next slide. There are two main causes of adrenal insufficiency. The primary adrenal insufficiency is also known as Addison disease. It's caused by the damage of the adrenal gland themselves, leading to the reduction of all three classes of adrenal corticosteroids. The secondary cause is by a lack of pituitary ACTH secretion, which leads to a deficiency of corticosteroids and androgens. Mineralocorticoids are rarely affected in this type of adrenal insufficiency. Other causes of adrenal insufficiency include adrenal hemorrhage, often related to anticoagulant therapy, chemotherapy, ketoconazole therapy for AIDS, and bilateral adrenalectomy. Next slide, please. So for risk factor, we have an autoimmune response, is one of the most common cause of adrenal insufficiency. Those with autoimmune adrenalitis often have other immune disorders such as type 1 diabetes, autoimmune thyroid disease, um, pernicious anemia, and celiac disease. This disease can affect both gender equally and most commonly occurred in adults under 60. Next slide. Um, for signs and symptoms, Addison disease can be a challenging diagnosis due to its slow and insidious onset. In fact, it often remains undiagnosed until a significant amount of the adrenal cortex have been destroyed. The main symptoms are anorexia, nausea, weakness, fatigue, and weight loss. Additionally, the presence of bronze-colored skin hyperpigmentation due to negative feedback. Um, other, other symptoms, we have hypotension, tachycardia, dehydration, weakness, and confusion. We also have Addison crisis or Addisonian crisis, which is an acute adrenal insufficiency. We go to the next slide, I'll explain a little bit more on that. So on the adrenal, adrenal insufficiency, sorry. We have for Addisonian crisis. This can be life-threatening. This occurs when there is a sudden and severe deficiency of adrenal hormones, such as cortisol and aldosterone. The symptoms of the Addisonian crisis can include sudden penetrating pain in the lower back, abdomen, or legs, severe vomiting and diarrhea, dehydration, low blood pressure, and loss of consciousness. Next slide. For labs, adrenal sufficiency is a condition that can be challenging since its symptoms often mimics other disease. A variety of tests can help healthcare providers provide and make a diagnosis. Here are some common labs and diagnosis tests in the evaluation of adrenal insufficiency. We have the ACTH stimulating test. This diagnose the adrenal insufficiency. During this test, they take a small sample which measured the cortisol level. We also have the CRH stimulating hormone, test is another one that is used. We also have the CT and MRI scans are used to examine the size and shape of the adrenal glands and pituitary. We have the EKG, and we also have some serum electrolyte levels are often abnormal in adrenal insufficiency. Sodium levels are typically low, while potassium levels are high. Additionally, serum glucose levels are often low in patients with adrenal insufficiency. Next slide. For nursing diagnosis, we have, as a nurse, it's essential to be familiar with the patient diagnosis associated with this condition to provide appropriate care to patient. One of the common diagnoses is insufficient activity intolerance. So with this, we may need, or the patient may need to limit the activity to avoid exacerbating these symptoms. We also have disturbed body image. We have deficient fluid volume, imbalanced nutrition, and finally, we have risk of injury related to weakness and risk of fall. Next slide. I'm not gonna go into details with those. For nursing intervention, we have fluid and electrolyte balance, which we monitor the patient daily weight, urine output, and input and output, or intake and output. For nutrition, we have their salt intake increase. We also have high protein diet. For hormonal regulation, we have fludrocortisone. We have corticosteroid replacement. They also take glucocorticosteroid, which is a split dosing. They take 2/3 in the morning and 1/3 in the afternoon. And for stress or an infection, they should notify their PCP or the healthcare provider, just in case they're sick, so they can ensure a proper adjustment to their medication regimen. For crisis intervention, they need to take a high dose of hydrocortisone and also 5% of dextrose and 0.9% of normal saline, and manage the ABC. As education, or as a nurse, we should encourage our patient to wear medic alert bracelet in case of emergency, carry emergency kit with 100 milligrams of hydrocortisone and syringes, and encourage our patient to anticipate and plan for stress situations. For example, for flu, fever, any tooth extraction, or rigorous physical activity. I'm going to hand it off to Gio for our case study.
Okay, thank you, Mara. So this case study is based off an article called Cushing Syndrome, Challenges and Advances in Diagnosis and Management. So I'll let you pause the video so you can read the information. And the next slide has a few vital signs and lab values. As we can see, the only vital sign that is out of normal range is blood pressure. For the first question, we would have to I'll give you the answer. If you chose D, the answer is correct because these would be symptoms of Cushing syndrome. The second question, to select all that apply. And the rationale for this is B and E because hyperglycemia occurs with Cushing syndrome because glucose intolerance is associated with cortisol production. Also, high levels of corticosteroids increase risk of infection and delay wound healing. I'll give you a second to read the information on the second part of the case study. And question 3, the patient has an adrenalectomy, which should we anticipate for discharge planning? We would anticipate glucocorticoid replacement therapy because the adrenal cortex is no longer producing the necessary glucocorticoids, so they need replacement therapy. For question 4, which of these would be likely complications of Cushing syndrome? And of course, these would all be complications of Cushing syndrome. Question 5, how will the nursing team collaborate with the healthcare provider for this patient's condition for pharmacological and non-pharmacological interventions? And the answer is promote adherence to treatments, because in this case, the patient has had an adrenalectomy and replacement therapy is crucial for this patient because they won't be producing the necessary glucocorticoid on their own. And they need to undergo replacement therapy for the rest of their life to maintain a healthy level of glucocorticoid in their system. As for QSIN competency, we chose teamwork and collaboration, seeing as the endocrinologist, the surgeon, nutritionist, and pharmacist all work together as a team to provide high quality care for the patient. The team collaborated correctly and diagnosed the patient effectively, and we're able to give effective therapies through open communication and mutual respect for each other. So this concludes our presentation, and thank you very much for listening to us.